We will be recording today's webinar and posting it to the Public Health Communications Collaborative website later this week. And with that, I'll turn things over to John Auerbach to kick us off.
Webinar of the Public Health Communications Collaborative, or as we refer to it, the PHCC. As a reminder, the PHCC was formed last year with support from the CDC Foundation and the de Beaumont Foundation to support and amplify COVID-19 public health messaging and increase Americans' confidence in guidance from the Centers for Disease Control and Prevention and state and local public health officials. We have resources on our website, and we also do these monthly webinars to provide you with tips and techniques to effectively communicate public health messages. As always, our webinars aim to provide you with the latest in terms of updates and communication guidance, because we know that those of you who are on the front lines are on a daily basis answering tough and ever-evolving questions about COVID-19. So today, we are enormously pleased to benefit from the expert insights, knowledge, and skills of our two guest speakers, Dr. Ann Schuckett, the Principal Deputy Director of CDC, and Charisse Nunez, who's the lead of the Ad Council's COVID campaign. Now, before I introduce them and review our agenda, I want to give our presenters a sense of who's participating today and your most pressing communication challenge. So we're going to ask you to answer the two questions that you're going to see on the screen in just a minute. So you should be able to see the poll on your screen. So please take a few seconds to answer the questions. First, answer which term best describes where you work. And then you have to scroll down a bit, and then you can answer what is the most pressing communication challenge that you're facing. So we'll wait just a bit of time while you answer those, and we'll show you the results. I'll wait just 2 or 3 more seconds, and then I'll see if we've got results. And let's see if that will pop up on the screen. Tim, should I be seeing them soon? The poll has ended, so we expect to see those results. Okay. Well, there we see that we've got a wide range of different participants today. We certainly have the largest number appear to work at either a state or a local health department, but we also have participants from national government, probably public health agents, CDC and other health agencies, and we've got a fair number of people from the non-governmental sector as well, including people who work in education. Now, let's just see in terms of the second question. The second question is the most pressing questions there, and there the two areas by far that have the most, where there's the most interest are vaccine confidence and vaccine distribution. And so that's great, because those are exactly the questions that we're going to be talking about today. And we've got, as I said, we've just got the best possible people to be talking about that. So let's move into our agenda. As I mentioned earlier, we're thrilled to have Dr. Ann Schuckett, Principal Deputy Director of CDC, and Charisse Nunez, who's the lead from the Ad Council's COVID campaign. I would say before introducing those, I just want to go over what the agenda will be. We'll first hear from Dr. Schuchat, and then we'll hear from Ms. Nunez. Each of them will present comments and share information. Following that, we'll turn things over to Dr. Judy Monroe, who's the president and CEO of the CDC Foundation. And she will ask questions of both Dr. Schuchat and Ms. Nunez. And during that time, there'll also be an opportunity for you to ask questions, for you to participate in discussion as well. So as you are hearing the presentations and as you are hearing the initial questions that Dr. Monroe asks, feel free to write a question of your own in the chat box on the screen. Melissa's going to be reviewing the questions that are coming in from you, selecting those, and if it's possible, she may even ask you to read the question yourself. Finally, after those questions and answers, we'll turn things over to Brian Castrucci, who is the president and CEO of the de Beaumont Foundation, and Brian will share some of the latest and most timely resources from the PHCC. So let's start with our first speaker. It's really an honor to have with us Dr. Ann Schuchat. Dr. Schuchat has been CDC's principal deputy director since September 2015, but she's previously served for many years as a leader in the nation's response to infectious disease outbreaks. She served as the director of CDC's National Center for Immunization and Respiratory Diseases, and she played key roles in CDC's emergency responses, including the 2009 H1N1 pandemic influenza response, the 2003 SARS outbreak, and the 2001 bioterrorist anthrax response. There simply is no one more knowledgeable in the nation when it comes to responding to a pandemic than Dr. Schuchat. So, Dr. Schuchat, we're delighted to have you here. I turn things over to you.
Well, thanks so much, John. It's a real pleasure to be part of this session today. And I just want to start thanking everyone who's joined us. I think you're coming from public health and healthcare and education and other sectors, and first and foremost, the communication world. And you have been on the front lines of the worst public health emergency in over a century. You are tired. You have been attacked. You have had to face just unimaginable challenges day in and day out, month after month. And my heart goes out to all that you've been through. At the same time, our nation and the world has been going through a really traumatic and difficult event. Today, we expect to cross the 500,000 death mark, and we're probably going to cross the 28 million reported cases in the U.S. And that's not even talking about the disruption to people's lives, the challenges for children, the loss of livelihoods, and on and on. On the other hand, public health has never had a spotlight like this, and a chance for the real impact and meaning and value of public health to show its work. I want to say a few words about vaccine distribution and about communication challenges and about what each of you is facing. And I think that from the world of vaccines, I could say that we're sort of in the best and worst of times. I think from the seat that you're in, it's probably the worst and a little bit of the best of times. You know, we have a virus we didn't even know existed until December 31st, 2019, and we already in the U.S. have 2 authorized, extremely effective, extremely safe vaccines, the Pfizer and the Moderna messenger RNA vaccines. We're on the cusp of the Food and Drug Administration committee reviewing material related to a 3rd vaccine, the Johnson & Johnson or Janssen vaccine, that will be reviewed by FDA's committee on Friday and Saturday. and it will then be reviewed by, assuming the FDA moves forward with an authorization. The CDC's Advisory Committee on Immunization Practices has scheduled a meeting on Sunday and Monday to evaluate the recommendations for an authorized vaccine should we have authorization. So potentially 3 products by next week, and a huge demand. I know for many of you who've worked in public health and vaccines, you seek those days where people are really excited and interested in wanting to get a vaccine. But of course, we do not have the supply yet to meet that demand. At a time of very high demand, there's also substantial reluctance or lack of confidence in the vaccine or vaccination in individuals and communities with a number of features that I think Teresa will probably go into. But it's really that best and worst of time, high demand and high concern, many different products. The distribution that's going on is another challenge. We have multiple channels of distribution, and things are looking different in different states and in different communities. And that makes the job of communicators even more important, trying to be consistent and communicating what we know when we know it, and making sure that we don't look like we're contradicting each other in this very dynamic situation. And so it's why a webinar like this is so important, and why CDC and state and local public health are really trying to over-communicate, even though we know it's a changing message. Most of the vaccine supply is going out through state, local, tribal, or territorial health jurisdictions, through the government entities, either the state health department or city health department, or for many of those living in Indian country, through the Indian Health Service if the tribe selected that option. We have a few federal channels that are on top of that jurisdictional channel of distribution. The Federal Pharmacy Partnership, doses aimed directly at federally qualified health centers, and SEMA led with a lot of CDC, state and local collaboration, federal sites, community vaccination centers, at stadiums, at gyms, at schools, and some mobile and pop-up clinics. We have a few other federal entities that are allocated to get vaccine, like the VA, or as I mentioned, Indian Health Service or the Department of Defense, and they're vaccinating the eligibles in their community. As you all know, the criteria for who is first in line or second in line or third in line have been contentious, while there have been very transparent evidence-based reviews to try to come up with criteria for that supply-constrained scenario. When the rubber hits the road, it's been challenging for those administering the programs, and certainly for the public who's been trying to access the product. The first phase, targeting healthcare workers and people living or working in long-term care facilities. The next phase with an elderly population and frontline workers beyond the healthcare, and then additional phases with older people, as well as the non-frontline essential workers. We have about half the states prioritizing teachers, firefighters in other places, and on and on. And so the decisions that state and local public health and the federal government have put forward have been very difficult for consumers to navigate. Turns out if you're a affluent elderly person with grandchildren who are really good on the internet, then you can probably get an appointment at some point. If you live in Texas or Louisiana or New Mexico, that appointment might have been canceled because of terrible weather and no shipments and power outages, for instance, that extended much longer than people had wanted. So what I can say is, how do you communicate in a circumstance with so much dynamic, breaking public health information? How do you get the word out and retain your credibility? How do you not look like you're contradicting what you said yesterday, or when you're speaking with the media in the evening, you have to go back on what you said that morning. And I think for many of you, it's turning to the tried and true methods of risk communication, acknowledging that you care, showing your empathy, showing transparency, and trying to earn the trust of the people listening to you. Acknowledging that it's a dynamic situation. What you're saying today could change. It could change quickly, but when you know more, you're going to share that. This is really important in terms of confidence in vaccines, because we have many people in the country and some groups in the country that are very skeptical about vaccines, whether because of the pharmaceutical industry or the government roles, or because of concerns about safety or concerns about side effects. Vaccines don't start with really high confidence across the board. And when you have a new virus and new vaccines, it's very understandable that people will have a lot of questions. And it's really all of our jobs to take those questions seriously, to treat people with dignity and respect, to listen and acknowledge people's concerns, and to have the best available information to answer them. The two vaccines that have been used pretty widely now, to me, knowing that 65 million doses of the Pfizer and Moderna vaccine have been administered so far in the United States, and we have had very active safety monitoring of those products. Before they were authorized, they had very large clinical trials that were quite reassuring in terms of side effects or unexpected adverse events. And now we have experience with 65 million doses. We get questions about women who are pregnant and should I get the vaccine? I'm a healthcare worker, I'm in the front line. Vaccines weren't studied in healthcare workers. Well, we've actually set up a registry, and we have quite a large number of pregnancies that are being followed together with following up for what happens to the babies. So far, very reassuring information. But what I want to say is that we're going to keep looking, and that we want the public to know that safety is important to those planning and administering the vaccination. We saw early on a problem with allergic reactions, anaphylaxis, and we adjusted guidance for how to administer vaccines because of that. And we've seen a diminution of the anaphylaxis reactions requiring substantial care because of those precautions and because of the way the vaccines are being administered. So I think, since I know we want to have a lot of time for questions, I just want to say that really that way that we communicate is as important as what we communicate, and the circumstances are changing literally daily if you look at the storm as any example. That said, we are exceeding the targets that had been set, this goal to achieve 100 million doses administered in the first 100 days of the Biden administration. We're on track to beat that, but we want to really beat it. We want to get way beyond the 1.5 million or so average vaccinations a day that we're achieving right now. And that's going to take everyone, not just those in public health and in vaccine distribution, but members of the public, members of the clergy, community organizations, people who have influence over their neighbors and friends and relatives, to address the questions that people have and make sure that you can help people find the information they need to get the appointment that they need, to get the follow-up that they need, and to really protect as many people as possible, as quickly as possible. I think that just the last thing I want to say is we want to go fast, but we want to be fair. And so equity has been a principle that the administration and CDC for sure have built into the way this vaccine is being distributed. And that's not easy. Whether you're starting with concerns or potential distrust that may be very valid over ways people have been treated by the government or the healthcare sector, or over decades of systemic racism, achieving equity is difficult. Committing to equity and taking the time to achieve it is something that we're working very hard to do. We don't want anyone to be left behind. We're making extra efforts for those for whom it will be the most difficult to access the vaccine, to answer their questions and help them get to the appointments, and have pop-up clinics or mobile clinics or stadium clinics near them So those are just some principles that I wanted to share. I think so. We definitely have time for discussion. I'm going to end there. Thanks.
Well, thank you so much, Dr. Schuckert. Really appreciate those comments and look forward to the question and answer portion of this webinar. It's now my pleasure to introduce Ms. Charisse Nunez. She is the Insights Lead of the Ad Council's COVID-19 campaign. And as such, she leads a specialized team at the Ad Council that has been engaged in a research effort to compile insights from dozens of projects that help to inform a COVID-19 vaccine education campaign. Today, she's going to share those insights and provide guidance on how best to communicate about the vaccine with different audiences. She'll also give us a little bit of a preview of the campaign that the Ad Council will be releasing tomorrow. So please join me in welcoming this nationally renowned communication expert, Ms. Charisse Nunez.
And good afternoon to everyone. It's certainly my great privilege and honor to be here and to be part of supporting this very traumatic public health initiative for all of us. So here at the Ad Council, we have been initiating a very comprehensive and focused effort on understanding the mindset, particularly of those who are undecided, who have low vaccine confidence, really with the intent of assessing how to most effectively communicate, reach them in a very relevant way. So on the next slide, what I'd like to begin with is a view of what we're seeing today of the adoption continuum. So how are vaccines being adopted? Where does the general public stand to date? And what we are seeing is that it is evolving as we would expect, and there is positive momentum, yet opportunities remain. So as of yesterday, we know based on what CDC is reporting that approximately 14% of the population has been vaccinated with at least one dose. A third are committed, ready and willing to get vaccinated as soon as it becomes available to them. And 15% are resistant, either because they have not personally been affected by COVID or they believe in alternative methods of prevention and treatment. Where our communication efforts are focused in where we believe the opportunity resides is with the 40% of the population that has a wait and see mindset. And the good news is that in December, when we first executed this research, this wait and see segment was approximately 50%. And so it is definitely for sure that as people are getting vaccinated, it is certainly helping to increase the confidence of those that are undecided. On the next slide, just to give a view, because it is important for us that we stay abreast of what's happening across various demographics, and I'm showing race and ethnicity, but we're also looking at age, we're looking at other areas as well. But what we see is that the positive trends across demographics, both with vaccination and with the percent of the population intending to get vaccinated, is improving. Particularly among the Black American population, I will tell you in December, that intending segment was only 12%. So it was very encouraging for us to get this information. This was literally hot off the press last week, to see that there has been movement and increased engagement. Okay. Yet you still see with that segment of the population about 20% resistance. So opportunities definitely remain. Now, on the next slide, we take a two-pronged approach in understanding the overall intent. So we look to see what the willingness is, and then we also want to understand, if you are willing, where are you on the spectrum in terms of when you plan to get vaccinated. And what we see is that the undecided population, as mentioned, they have a wait-and-see mindset, and many intend to wait months before considering vaccination. Now, what does that mean? It means they're waiting and watching to see the response of those that have already been vaccinated, because they really want real-world evidence that the benefits outweigh the perceived risks. They're also seeking information to address concerns that they have. So about 50% of the population in that wait and see segment are indicating that they will wait 4+ months. And some are still saying, I'm still not quite sure that I want to get it. So on the next slide, the question for us is always, and this continues to evolve as things are changing, why are people undecided? What is driving the low confidence levels? And it still is centered on 4 key factors where information deficit and misinformation exist. There's still concerns about safety and side effects among this segment, particularly around the long-term side effects. There are questions still around the speed of the clinical development. Many just don't fully believe that the testing process was as rigorous as we know it was. We know that there's distrust in the political and economic motives. In some of the recent information that I've seen, which is hot off the press around misinformation, there's a lot of conversation around pharma being protected from legal action. And so that has raised another lens of hesitancy. And then the established and novel conspiracy theories, which do surface to a lower extent, they also contribute to lower confidence in vaccines. So we do know that the reasons behind distrust and the beliefs in conspiracy theories, they do vary by race, ethnicity, and political affiliation. But ultimately, these concerns are real. They are valid in some areas, and they're pressing on the hearts and minds of those that are within this segment. On the next slide, when we look further, again, monitoring the trends in the attitudes among the population, we do see that there is a significant divide between those that are undecided and those that are intending. On the areas of getting vaccinated being important, the extent to which they're confident in the knowledge that they have to make an informed decision. You see significantly lower levels among the undecided segment versus those that are intending. And then also you see lower agreement levels on the perceived benefits outweighing the risks. So this is, again, very helpful for us as we are crafting our campaign, understanding what are the informational needs, and how do we need to engage with them so that they can get informed and make the right decision for themselves and their families. So we're monitoring this on a monthly basis. Again, I will say this has improved significantly. In December, these numbers, figures on the right-hand side under the undecided were in the 40% range. So as more information is being presented, confidence is increasing, but it is a process. Okay. Now on the next slide, again, further reinforcing the need to elevate the benefits and ensuring that they outweigh the perceived risks. So you can see yet again here that there is a huge divide in the perceptions of vaccine safety and efficacy among the undecided versus those that are intended. So this is, again, reinforcing what our task at hand is with this group. On the next slide, just to give a little bit of an overview, we recognize that our communication strategy is not a one-size-fits-all. So it's very important for us to look across a variety of demographics. Here, I'm just showing race and ethnicity, which is one lens. And I'm not going to go into the great detail, but just want to demonstrate to you that it is important for us that we're monitoring this and we're getting a granular level of understanding, because our campaign efforts will be unique, culturally relevant, and tapping into the insights and the need states across these various consumer groups. What I will say is when you look at the psychographics, there's a lot of consistency. So there are some areas where they're quite homogeneous. Psychographically across the board, there is a general level of distrust in government, and that it really is centered more on ethics, perceived ethics, as well as just competency. And a lot of that is also leveraged from work that has been done by the Edelman Trust, a brand trust report. But where you do see some nuances is that among the white American population, we see that Relative to the other segments, they have limited to no personal experience with COVID. Among the Hispanic population, we know that they definitely feel that they really don't have adequate information to make an informed decision. And then among the Black American population, we do have the challenge that there are suspicions among this group of being guinea pigs. And we know a lot of that suspicion is linked to some of the historical unethical practices in healthcare and access inequities. So while there is some continuity in terms of the drivers, there are nuances that we have to be very mindful of as we're communicating with these audiences. So on the next slide, what are the messages that actually resonate? And what we found is that there are messages that resonate and are relevant across demographics. And these are leverage points for how we're building out our campaign. We gained rich insight on how to effectively connect with this group. And what we found is that first and foremost, we have to acknowledge the concern rather than challenging it. And providing the promise of scientific, fact-based, unbiased answers is very important. Tapping into the audience with emotively is also very important because this has been a very high emotive time. And many of us have missed a great deal during this experience. So highlighting the moments of human connections that have been missed, they serve as a powerful reminder as to why getting vaccinated is a pathway to regaining these moments. Elevating the concept and the theme of protection. So the emphasis of protection, not only protecting myself, but more importantly, protecting my loved ones and those that are most vulnerable. And above all, engaging with an inviting, respectful tone as opposed to one that's demanding or mandating. And we do have to acknowledge that this is a personal choice. The decision is yours to make, but we can do that in a way without undermining the importance of consideration of the vaccine and the importance of the decision. On the next slide, we also did work just to make sure that we understood what are those moments of human connection that are being missed. Again, this is important for us because we're leveraging this for creative ideas for our creative platform. So we know, and we can all relate, that everyone is missing moments of in-person connection with family and friends. It's more those intimate visiting of families with holidays, going out with close friends for dinner, and getting children back to school. Those are broadly relatable and most missed across audiences. And these are some of the themes that you'll see as underpinnings in our creative work and in our campaign. What have we learned on the next slide regarding messages that we should avoid or messages that do not resonate? And I guess these are themes that are across the board. If we can move to the next slide, please. So avoiding reminders of how difficult a year it has been, elevated and not to elevate negativity and fear. I mean, these invoke a sense of hopelessness. Also avoiding fear tactics that don't serve to generate trust or guide to get those questions they have answered about vaccines. Telling them it's the right thing to do comes across very accusatory and very off-putting. Overpromising. So most understand that mass vaccination is a long-term process. So avoiding messages that imply that getting vaccinated will be, will make it available to us to see a flip of the switch, that everything will change immediately. And then finally, we did a lot of work to understand what is it that the American public is looking for. Are they looking to get back to normal? And for most, they acknowledge that post-pandemic life will never be the way it was. It's more about getting back to life rather than getting back to normal. So on the next slide, it just some additional areas for us to be very mindful of. What are some of the consumer-facing language do's and don'ts? And I'm going to focus just on what we should be focused on, and you can read along with what we should not say. We should reinforce the safety and the efficacy of the vaccine. Again, making sure that there is clarity that the benefits do outweigh the risks based on the clinical trials, on the clinical studies, and on the millions of people that have already taken the vaccine. That is very important. communicating that this is authorized by the FDA based on clinical testing. And I will do the opposition here. While, yes, it was a huge feat and undertaking, that it was delivered very quickly, and a lot of credit that was done. We need to, emphasizing that reinforces hesitancy and concern. Getting the latest information. Things are evolving, things are changing daily, and we have to acknowledge it, because I think sometimes the inconsistencies or the change in the conversation and coming even from leadership can create anxiety. So we have to make it clear that we're going to be presenting the latest information as we know it and get it consistently. Focusing on keeping your family safe and those most vulnerable safe. An emphasis and reinforce that this is for public health, references to the public health, not to the government. References to medical experts and doctors, and we'll talk a little bit more around who those trusted sources are and who the advisors are and where a recommendation should come from, medical experts and the doctors. References to scientists can be a little disconnected with the day-to-day realities of what people experience and are exposed to. And then we're learning that we absolutely have to be careful. We have to avoid labeling across the spectrum, regardless of where people are sitting on that adoption continuum. People who have questions, they're undecided, they're in the decision-making process, they need more information rather than labeling consumers. Okay. And so on the next slide, this just basically shares high level that while the message is very important, the messenger is as important. And medical professionals, community healthcare providers are most trusted, particularly pertaining to this situation. And a call to action to get vaccinated is best to only come from these sources. Of course, and we at the Ad Council, we have a huge initiative working with relevant community-based organizations, faith-based organizations. They are very important and can help to build cultural consensus within the community. And so we're partnering with them on how we best engage in the conversation so that those that are undecided can get the answers addressed that they have so they can make an informed decision. And then, as you would expect, on the lower end of the spectrum of trust, you have the news media, you have entertainers, not saying that they should be discounted, but again, they have a unique place where they can be leveraged, or they should be use their leverage as a platform for the medical professionals to reinforce the information that the American public is looking for. And then on the last slide, again, our strategic framework and how we are bringing this to life is, and what we believe is going to motivate this audience, and all of our testing is indicating that what we can do effectively is motivate this audience to get informed. The more people get informed, the more people are having conversation with those that have been vaccinated, it does lead to action. But we have to lead with empathy and respecting the questions and provide the facts to address those concerns, pulling on the emotional levers, that vaccination is a pathway to eventually getting us back to life and to the moments of human connection that we miss. And then, of course, leveraging the messengers who are most credible and most relevant for the target audiences. And that is our approach and our strategy. I would have loved to have shared with you today the actual campaign that is going to be launching tomorrow. I will be providing for all of you a link to where you'll be able to access that and see that once this information is distributed. So thank you for your time, and happy to address any questions that you all may have.
Well, thank you, Ms. Nias, for that fascinating presentation. And a number of the people have been writing to say, can you share those slides? And we'll be working to share those slides with the participants so that they can really take advantage of this incredible insight into how best to message. So thank you very much. I now am going to turn things over to Dr. Judy Monroe, who is the president and CEO of the CDC Foundation, and she's a COVID expert in her own right. She's a former state health commissioner from Indiana and a former senior official at CDC. And Dr. Monroe will be asking questions of Dr. Schuchat and Ms. Nunez, which have been previously submitted. And then as a reminder, there will be an opportunity for her to also relay questions that you've submitted during the webinar. And I've been seeing lots of questions coming in. So please do submit your questions there. And with that, it's my pleasure to turn things over to CDC Foundation President and CEO, Dr. Judy Monroe.
Well, thanks so much, and great to be with everyone. So we are really looking forward to your questions. And again, I'm really thrilled to have Dr. Schuchat and Ms. Nunez joining me to answer these questions. Just a little housekeeping. You can submit your questions in the WebEx chat feature directed to all panelists. Please include your affiliation in your question submission. And when called on, we will unmute your line so that you can ask your question. And while the questions start coming in, we're going to start with a few questions that were submitted ahead of time. But I'm actually going to jump in with a question, Dr. Schuchat, to you. You mentioned the J&J vaccine. That's kind of hot off the press news. We're hearing about the safety. I was very happy to hear about the safety. Can you say just a few words about what this means for our efforts with vaccine now that the J&J vaccine may get emergency use authorization very soon?
Yeah, of course, we're looking forward to the FDA's review and to the Advisory Committee on Immunization Practices review. But I think, assuming that things go forward, the availability of a third vaccine is very exciting. You know, number one, because it should help with our supply challenges. Number two, because the J&J vaccine is a single-dose product. And number three, because it's a single-dose product that has pretty normal storage and handling requirements. And with the Pfizer product, you know, we're in these sub-zero freezing environments, and the presentations of both Pfizer and Moderna have been a bit challenging for the cold chain infrastructure of our nation. So the J&J product will probably be much more amenable to rural use or mobile clinics or, you know, to a lot of different settings. So I think that more is good in this case, and the particular use cases or approvals we'll need to see. You know, I think that this is a different technology than the two first. It's not a messenger RNA vaccine. It's an adenovirus vectored vaccine. And, you know, I think it'll be very exciting to have a third product that becomes available.
That's great. Thank you. The next question I have for both of you, and this one has to do with, you know, a lot of people are hitting the pandemic wall. How do we break through this fatigue when we're asking them to keep wearing masks, stay at home, even if they get vaccinated? I mean, how do we break through this?
Yeah, I think there are two parts to that question. You know, one is about pandemic fatigue and, you know, how do you make it through one more day with whatever your life circumstances are, with or without employment, with or without kids at home that you're suddenly schooling remotely. And I would say that this is an all of society problem, and we're all working together to try to get us back to life, as Sharice Nunez described, rather than back to normal. But, you know, I think that these efforts we've had the past month or so have really started to bear benefits, you know, with the 100-day mask challenge and with the intensified efforts to, you know, avoid travel, avoid crowds, you know, keep our distance. We're seeing really impressive drops in disease, hospitalizations, and deaths, even though we're still at higher levels than any time before November. So we're higher than the summer peak still. So because the vaccine is getting out there now, you know, instead of this seeming like it's going to go on for absolutely ever, you know, there is that beginning glimmer of light at the end of the tunnel. And it's not a time to relax our vigilance, but a time to redouble our efforts to really get transmission down, especially in light of the variants that we're seeing around the world and also here in the U.S. Now, in terms of I've been vaccinated and I still have to do all this stuff, what is that about? I would say that, as the science evolves, we're trying to update information so people can understand, well, what's different now for me personally if I have been vaccinated and completed the series? What am I able to do in terms of, seeing my grandchildren, for instance? What can I do in private? What about the public setting? And when we're in a circumstance where most people haven't been vaccinated, we may be seeing people who've been vaccinated to perhaps extend a little bit in private, but not yet in public. If they're in the healthcare environment, that's a really extremely important environment that we're really trying to protect the most vulnerable. So I think this will be sort of a risk assessment of less risky, more risky for you as an individual, less risky, more risky for those around you, those who, in the family, loved ones, as well as the community. But I would say we should really, invest in nicer masks because they're going to be with us for a while.
That's right. You can have a little fashion statement with the mask. Sharice, do you want to add anything to the pandemic wall? How to overcome that?
I would say in our conversation with consumers, yes, this is definitely something they're experiencing. I think, more recently, people are beginning to navigate in smaller environments to kind of alleviate the fatigue. So, I think we're seeing that people are beginning to, to take it upon themselves to do what they need to do to navigate carefully and effectively, so that the fatigue does not result in more despair. So, that's pretty much all I can share with you in terms of what we're hearing from consumers now. I guess we'll have to, but, we do have to continue to reinforce that even in these small settings that they're beginning to take more liberties and engage in, that they do have to take care and be cautious, and masks are important.
Thank you. So our next question, we're going to shift here a little bit. There are concerns about the possible long-term side effects of the vaccine that are circulating on some media and social platforms. And as health professionals, we know that long-term side effects with any vaccine are not likely. What's the best way to credibly address these concerns when the reality is at this point we have really a short history with the COVID vaccine?
Yeah, as a medical expert and public health expert, as opposed to a scientist, I would say that we know that the virus is being linked with some individuals who have longer-term symptoms, and that's an important clinical syndrome that's being studied. So I think when people are doing that benefit risk of, do I want to get vaccinated or do I want to get disease, it's kind of complicated with this virus, and some people have no symptoms, some people have mild symptoms, and some people, and more, all of us know people who've had, hospitalizations or even death from the virus. You're trading off that short-term possible terrible disease, but also a long-term syndrome with a vaccination, which we think, based on everything we know so far, is highly effective and very safe. We haven't looked at people 5 years after they've gotten these vaccines, but there's no reason to think there are going to be unanticipated problems. That said, we will continue to evaluate and follow. So I think individuals, as Ms. Nunes said, putting that choice in an individual, not taking the option away from them, sharing the dilemma of, no, there's not a lot of people who've gotten this vaccine 5 years ago, but based on everything we know, it's likely this is very safe longer term, and we're going to continue to look. We know so far already, with less than a year of the virus, that the long-term consequences of infection can be severe, including people who have mild infection.
Thank you for that. So let's move to the next question. There are already variants that are spreading that cannot be fully prevented by the vaccines, and more are sure to develop. So how do we encourage people to get a vaccine we know will not entirely eliminate the virus without overstating the importance and further eroding trust in public health? Ms. Nunez, do you want to start with that one?
Well, I will tell you again, how to manage and encourage people to get vaccinated, I would, definitely defer to Dr. Shuckett. But what I will say is that, yes, this is surface. We recently did some research to understand the impact of some of these messages and what percent of the population have serious doubts about the vaccine because of some of these new conversations. And the variance, about a third of the population have serious doubts about the vaccine and getting the vaccine because questioning, if I get it, will it be effective against the variant? Should I wait until we have more information? So I think one of the ways that we can address this is why waiting, how can we clarify why waiting for either maybe another vaccine that has been tested against the variants may not be the best approach. So I would give that counsel that I do think there needs to be clarity to address why waiting is not the best approach and why getting the current vaccines to address the COVID-19 that is, more dominant now is direction to be considered.
Thank you. Dr. Shuckett, anything to add to this question?
Yeah, I think that the emergence of variants that potentially are more transmissible and even more severe is of concern, and it's a reason for that intensification of our masking and social distancing, as well as, making sure that when you're eligible, you get vaccinated so that we really can tamp down variants before they're able to take hold. I think that the question of wait and see, as you heard, there's a lot that goes into the wait and see, and we were seeing less of the wait and see, and now maybe we're going to start to see an increase in the wait and see. I think we have that dilemma to share, that right now what we know is that the vaccines that are being used here in the U.S. have very good effect against the virus, that even in studies where there's been some diminution with the South Africa strain, with some other vaccines, there's still been better protection than it's diminished, but it's not gone. And so getting vaccinated is definitely better than not being vaccinated. This question of, well, if I wait a year or two, will there be other vaccines? I think that the risk in the meantime, that regret of the things that I'm not going to be able to do if I get sick in the meantime, I think those are the things I'd appeal to.
Yeah,
it's very, the communication challenges of this are enormous when you think about really trying to encourage people to get them over their concerns. Well, there's not enough vaccine for everybody to get. You really, please get the vaccine now. Well, I'm sorry, you can't because we don't have enough of it. So I think we have to balance those efforts and really do almost micro-targeting community by community, or as we try to address an individual's concerns or a group's concerns with that supply situation of the moment.
Yes, thanks for that. A lot of folks are using the word hyper-local, so that targeting. So I believe we have questions from the audience. Melissa, do we have?
We have many, so I'm going to go ahead and read them so that we get to as many as possible in these last few minutes. And we've had a number of questions about really messaging around the safety and efficacy of the Johnson & Johnson vaccine, that it is still very good. And yet, this questioner, Karen Hendricks, submitted that she's hearing from constituents who perhaps believe it is a lesser vaccine. So how do we communicate that it is indeed, as she put it, making sure they feel like they're getting the real deal?
Yeah, I could maybe start and see if Sharice wants to add. I think we really have this challenge of not trying to have a second-class citizen vaccine. And if it's the Karen Hendricks that I know, great to hear from you. But the issue, the encouraging issue with the J&J vaccine is that while the estimated efficacy against all outcomes was lower than what we saw with the Pfizer and Moderna products, the efficacy against hospitalization or death, the severe outcomes, was fantastic. And so there's really no difference in terms of those outcomes that you're really trying to avoid. We don't know yet about the question of transmission, and does one of these vaccines versus another do better at reducing shedding of the virus? You know, they all protect you against getting disease, but is one or more better against preventing transmission? And so I think that the Johnson & Johnson, in terms of looking at that severe disease endpoint, looks really similar. And the one dose may mean that you're protected a bit sooner than after the second dose of Moderna and Pfizer. So I think, you know, we'll see what the FDA says in terms of their indications or recommendations. And we don't want this to become, you know, these people get this vaccine and these other people get that vaccine. We're really trying to get as many highly effective and safe vaccine products out through the pipeline into people's arms as possible. But there may be messaging that's better than others. I don't know, Streets, if you have comments on that.
I think it's going to be interesting to see how J&J messages this. You know, they're phenomenal, you know, marketers at that company. But I will say that there are still questions about Pfizer and Moderna, despite the fact, particularly among the undecided, despite the 95%, you know, efficacy. And a lot of that is because it is a new technology, whereas the Johnson & Johnson is more the traditional, and apologies for the medical professionals if I'm not using the right term, but viral vector. I think it's more the traditional methodology, if you will. And so I have had anecdotally conversations with people who are really educating themselves on the differences. Some feel more comfortable with that. So again, I think that there are ways for J&J to message, and I think the point that you raised around, if I recall correctly, I mean, the figures related to the prevention of severe case of COVID and hospitalization was, you know, well into the high 80s, so not a substantial difference. I certainly think that it is very much a viable option, a comparable option, and has other aspects related to its development that may appeal more to certain segments. But again, it's all in how J&J crafts their messaging and communication.
We are just about at the hour, so I will ask one more question that's come in from a few folks, and also just note that we had many questions with respect to the Ad Council research and upcoming campaign. And as that's launching tomorrow, we will be sure to email to the Public Health Communications Collaborative list these resources this week so that you have all of that information in your inboxes. So the other question, the last question here came from Allison Elkins, and it really is around what you will be doing to what should we be doing to encourage and convince frontline and essential workers who have thus far declined to get the vaccine. A couple of folks have submitted similar questions about billing staff, maintenance, and other essential workers in medical settings.
Yeah, that's such an important question, and we know, you know, particularly in the long-term care facilities, we've seen this as an issue. The residents, it's like about 80% took up the vaccine, but the staff was less than 50%. And that's kind of what we see with influenza vaccine seasonally as well. So it's not a new issue. It's probably a longer standing issue. You know, I think understanding what the concerns are and the questions are is very important. And so the research that Sharice just described is helpful. But having people that are trusted, the validators can be important. So if there's the head nurse or the, you know, the orderly who everybody listens to that has had a good experience and can talk about it, that can be important. I think this hyperlocal thing is very relevant, that, you know, in the institutions where people have seen their colleagues do okay. I think it's important for us to be transparent about, you know, your arm's going to hurt. This is not one where you didn't know it happened. Very high percentage of people have sore arms after the first and second dose of Pfizer and Moderna, and in particular, that second dose can be can kind of knock you out. You might, you know, need to have a light day after it. So not sugarcoating that and helping people know about that, and messaging that's a sign often that you're getting a good response. I mean, it doesn't mean you did get a good response if you have no symptoms, but that's a good reaction, not a bad reaction. But I think that where is the trust going to come from? And it may not be, the owner of the long-term care facility or the president of the hospital. It may be peers or other influencers. It's difficult if you make it mandatory or you penalize people. And so really trying to help find supports that will reinforce the acceptance and address the concerns that people have. But for me, knowing that 65 million doses have been given and we're looking really carefully is quite reassuring. For a lot of vaccines, it takes a much longer time for us to accumulate this experience. It really can't be a guinea pig today, given how much vaccine has been given.
Well, thank you. Thanks so much to both of you. I think we are at time, and so I'm going to turn the program now over to Brian Castrucci, the president of the Beaumont Foundation, to go over the Phcc resources. So, Brian, over to you.
Amazing. So thanks, everyone, to the speakers and everybody who participated today. The questions you asked really help guide where we're going in the future. Just want to quickly point out some resources that are now on the publichealthcollaborative.org website. The first two here are, again, communication kind of infographic tools. I got a COVID-19 vaccine, now what? And making a decision to get a COVID-19 vaccine. And then this third one, which I think is really, really quite good, is it's a PowerPoint template that you can manipulate for your hyper-local area when you're giving presentations. And so we have that there. And then next slide, the only thing that I want to remind you all of is, much like the great philosopher Jerry Maguire said, help us help you. We are here for you. We want you to tell us what you need so that we can help provide it to you. Phcc is a service to the state and local governmental public health community and beyond. Email us at info@publichealthcollaborative.org and tell us what you need, and we're going to do our best to fulfill it. Just help us help you. So with that, I want to thank everybody for coming, and we'll be out soon with what our next webinar will be. So thanks, everybody.